Well, welcome back, folks. I'm Chris Cooney, President of the Metro South Chamber of Commerce. It's a pleasure to see and have our panelists with us again. Of course, when we started this 21 months ago, we did not think we would still be meeting like this. We were hopeful, even at the end of last year, like many of you, we thought the worst was behind us. We hope that the worst will be behind us shortly. A lot of indicators are, I think, trending in that way, but we'll hear more about that from several of our speakers. I do want to acknowledge that if you have a question for any of the panelists, please put it down below in the either the chat or the Q&A section. We'll be checking that, and I'll ask our panelists to address those or provide links. Our staff will also be providing links and along the way. In addition, we will record this session and it'll be made available at our YouTube station, Metro South Chamber YouTube station, and you'll be happy to review it or forward it to others to go back over the information. Sometimes the information covered can be involved, and it's good to kind of hear again what was said. I do want to acknowledge several of our partners who have helped us promote this event, including the Avon Industrial Park Association, the Bridgewater Business Association, the Brockton Area NAACP, the Campello and Montello Business Associations, the Cape Verdean Association, especially their Business Navigator program. We're going to hear a little bit about that today. Eastern Chamber of Commerce, the East Bridgewater Business Association, the Haitians United, the Massachusetts Small Business Development Center Network, the Norwell Chamber of Commerce, the Pembroke Chamber, Randolph Chamber, which now they go by the 24 Alliance, the South Shore Women's Business Network, and the Stoughton Chamber of Commerce. So we're acknowledge all of their help over the last 21 months as we've moved forward and promoted these COVID recovery calls. I'm pleased to have with us today Sue Joss, who is the president and executive director of the Brockton Neighborhood Health Center. Sue, as you know, represents the Neighborhood Health Center, which is one of the largest employers now in Brockton, and obviously is at the epicenter of treating many of the patients, and also in charge of a lot of prevention going on with vaccination and whatnot. So, Sue, thank you for being here. I know you've got a presentation. I think I'm going to share the screen here so you can go over some numbers. And thank you for your update.
Well, thanks for having me, Chris. And I wish I was bringing better news, but as you'll see in a minute on the charts, it's we're in the thick of it now for sure. Just to give you a few updates on what's going on at the health center. Many of you know and have taken advantage of the testing trailer that we were running at the Shaw Center. We had been doing vaccinations at the Shaw Center, which have now been taken over by Brewster Ambulance. Our testing has now been taken over by Transformative Health, and they're the same ones doing the testing at Massasoit. So we made that move because we had so many positive cases that we had to pull the staff back who were doing the testing so that we could keep up with all the positives in an effort to try to keep patients out of the hospital. So just for our own staff, just to give you a sense of how prevalent COVID is right now, a week ago, Friday, we had 94 of our 600 or so staff out on quarantine. They didn't all have COVID, but they all had symptoms. So this week, as of today, that's down to about 40. So it is still a big number, but cut in half. And, 3 months ago, if you had told me 40, it would have been a tremendous number, but we're kind of getting acclimated to the idea of these big numbers of staff and patients turning out positive. Our numbers at the health center for testing that we did during the past week is 47.5% positive. So that's a big number.
Yeah. Thinking back to when 4% was a high number, and now we're talking 47%.
So 4% would put the city of Brockton in the red zone, by the red, yellow, green that the state does. So 47%. The city as a whole is a little lower. They're in the upper 20s to low 30s. So we're seeing a disproportionate share of positives, but even just looking at the city number is pretty concerning. But let me share the slides. Those of you who are on this call regularly know that Dr. Rick Herman, who is the Mayor Sullivan's physician advisor to the Board of Health during COVID, prepares these slides. He's had to do them update every couple days now because things are changing so rapidly. But so here's the numbers. So this has been from the beginning of the pandemic current. So you see, even when things were at their worst at the beginning, it looks really low compared to what we're seeing now. So this number up at the top right, 408, that's daily cases in Brockton. So, you know, what we thought were high numbers before are just being blown out of the water by what we're seeing now. Cases per month, you'll see a jump up in December to a number that was higher than any other month during the pandemic. But if you look at January, this is Dr. Herman's projection based off the data he's seen so far. The gray line, he thinks that will be between 10 and 11,000 cases just for the month of January. So just absolutely staggering numbers. Hospitalizations are reflecting this. So right now, as of, I believe, yesterday, the combined percentage of hospital beds in the two hospitals in Brockton that have COVID patients in them is 46% of the hospital beds. The red line is what I have shown and what Dr. Herman has shown on every set of slides during the pandemic. And that's the line, if we crossed over that, hospitals have to start shutting things down. So the elective surgeries, for instance, start opening up overflow beds to COVID only, and they have started doing that. And I can say at the health center this week, we are in the process of canceling all of our physicals for the upcoming 2 weeks anyway, because we need all of our providers focused on patients who have COVID or who have other urgent non-COVID needs. So the physicals have had to go. We've cut our dental service by 40%. So we're starting to see those kind of cuts that we had at the beginning of the pandemic happen again. This is the percent positive. As I mentioned, the health center itself is 47.5%. The city's at 29%. This is a week older data though than the health center data. So I think when the city catches up, that gap won't be quite as big. Deaths in Brockton, this was on Wednesday. We actually are up to 12 as of today. This is Wednesday's scorecard. So Brockton's website posts a scorecard every day. And I've actually got yesterday's next. And the reason that I decided to post 2 days in a row is I want to show you a little glimmer of hope. So you see up in the top left, the 306 cases on Wednesday, and no deaths on Wednesday, but there was one on Thursday. On Wednesday, there were 149 patients in the two hospitals with COVID. 23 of those were in the ICU. And then if you go to yesterday, you'll see we went from 308 new cases on Wednesday to 238 yesterday. And I would say over the past 2 to 3 weeks, we have been over 550 cases a day twice, and at or near 500 a few other times. So this is better. 132 cases in the hospital and 14 in the ICU. That's a pretty big improvement, especially the ICU numbers in one day. So there is reason to hope, and you know the data is just not strong enough yet to say we've hit the peak, but there is reason to hope that we might have hit the peak. So we need to keep watching that data over the next couple of weeks. These are still huge numbers, but they're not the numbers we were seeing last week. And then just to give you a sense of all of the positive cases in Brockton, the vast majority, 55%, are among people who are unvaccinated. That's the big area there. This aqua color is people who had one vaccination. The darker blue, 31.5%. That's people who are considered fully vaccinated under the old definition, the 2 shots or the J&J.
Okay.
And then the 8.4% is people who have been boosted and still tested positive. I would say this doesn't tell the whole story, that even though this 8.4% is a pretty big number of breakthrough who are boosted, they're not getting very sick. So if you look at who's actually hospitalized and who dies, I believe only 1 person with a booster has died in Brockton, and very few with 2 doses. So I think the messaging is the vaccine is even more important than ever. It is protective. It does not necessarily mean you won't get positive, but it does mean you're much less likely to, and if you do, you'll be not as ill. And this gives the breakthrough cases. A breakthrough case means someone who's fully vaccinated and tests positive. This chart does not show boosted. So fully vaccinated by this definition is the old definition of two shots or the J&J. So you'll see of all of the fully vaccinated people in Brockton, almost 59,000, over 6% of them have tested positive. But only 0.06% of them have been hospitalized. That's 34, and 11 have died. And as I said, only 1 of those 11 has been boosted.
Okay.
So that's what I've got today, and happy to take any questions.
Thank you, Sue, for the update. We appreciate that. Just on the vaccinations now, you said that Brewster Ambulance and Massasoit are they, who's doing boosting at this?
So Brewster Ambulance is at the Shaw Center, and they're doing the vaccination, and that can be booster, it can be first doses, whatever they're doing.
Okay.
And they've got a good system worked out there, and they're able to get people in.
Are they taking walk-ins, or is it just by appointment?
They say no walk-ins right now. They were doing walk-ins, but they are, I believe, taking some.
Okay.
I think it hasn't been that busy though. We've been sending people there, and they've been getting right in.
Okay.
So I think they're okay. So
it's just worth taking a ride over there and seeing if you can get the booster if you need to.
yeah, or they have it online. I can post her in the chat. I'll post their online.
Okay.
Sign
I
up
appreciate that.
Register as well.
And then the testing is at Massasoit.
Testing is at Massasoit and at the trailer outside of the Shaw Center.
Okay.
And that is being done by Transformative Health, but both of them.
Okay.
Transformative Health, we were doing it, then there was a gap of a week, and Transformative Health started just this week.
Okay. And they're taking people from all over, beyond Brockton. Okay.
Right. Both for the vaccination and the testing, it's regional.
Okay. All right. Well, thank you very much for your presentation and for posting that additional information.
I'll get that right up.
Very helpful. Thank you, Sue. And next we have Sue Whitaker, who's with Mass Office Business Development. Welcome back, Sue. Also I know you're going to give a little bit of an update. I was hoping you might just touch briefly on the Workshare too, because that seems to be coming back into play with employers, furloughing or reducing people's hours at this point.
Absolutely. Yeah. So I sort of have a mishmash of of information to share today. So first off, the Massachusetts Office of Travel and Tourism Recovery Grant, that application is closing next week. That's Wednesday, January 19th at 5 o'clock. And so I know that Margaret has shared sort of a little bit more detail about that grant, but I can put some more information in the link if anyone's still looking to pursue that. Right now, I think at 2:30, there's a webinar happening with the Department of Public Health, and it's focused on, answering employers' questions about the new latest CDC and DPH guidelines. So hopefully that will be recorded and something that employers can take a look at just to get further clarification, because it's, it seems to be changing relatively frequently. And so I think people are just trying to grapple with what's required and sort of how to go about making sure that they're compliant. The Massachusetts Growth Capital Corporation, or MGCC, has a couple of ongoing small business grants. Again, we've kind of talked about these in the past, but I thought it was worthy to kind of bring them back to front of mind. The first is called Biz M Power, and that's a matching grant. And so you get the match with crowdsourced funding, and it helps small businesses in Mass get financial assistance with whether it's acquisition, expansion, or improvement of their lease or their facility, purchases or lease of equipment, and with other capital needs for their business. And so awards can range from $2,500 up to $20,000 in matching grants from the Mass Growth Capital Corporation. And then if you combine that with the crowdfunding dollars, you can earn up to $40,000. So that's a rolling application. It's been ongoing since the summer. The next review deadline is January 24th. In addition, they offer another grant, which is called the Empower Digital Grant. And those provide a match of up to $5,000 for, again, small businesses here in Massachusetts. And the funds are trying to work with businesses who are owned by socially and economically disadvantaged individuals, and they're trying to help with their development of their digital capabilities. And so what it does is you work with an actual technical assistance provider to try to identify, maybe where you're lacking in your digital skills. And then this grant is made to provide funds that you can use to cover fees for professional services and consultants, as well as software. So things like, hiring a graphic designer, a photographer, maybe for your website, or getting new cybersecurity investments in your platform, as well as maybe even doing a Wi-Fi or an internet package upgrade. So that's something that every bit helps. So that's something that just to be aware of. And as far as our labor and workforce updates, there's been a real focus for state and regional teams who are going to kind of set a strategy for internal supply and demand, meaning job seekers and job openings. And the goal is to have these functions that can support grant programs that are they're geared towards retraining and help closing the skills gap. So what they've done is regionally they are hiring, and most of these folks I believe are already hired, but a few regions are still looking for a new role that's called a market maker. And they're full-time employees that are geared to connecting businesses with training grants and working with training providers to enhance employer engagement. So businesses can talk to this market maker and sort of describe, issues that they're having maybe with their pipeline, that they just don't have candidates who have the right skills. And then that market maker will then collaborate and find the right training providers who could offer that kind of training. And then they have at the Mass Hire Career Centers, each person, there's a new role there called an upskilling navigator. And that person's job at the Career Center is to support job seekers who are looking for training and identifying those individuals. So you've got the people who are working on the supply side as like the job seekers and trying to make sure that what they're interested in, they have training opportunities, and then making sure that there's jobs at the end of the rainbow. So some of the training programs that are sort of roll up into these other roles are some you've probably heard of, which is the Career Technical Initiative, or CTI. And that's a program that leverages our vocational schools. So, the schools are running these programs during the day, and what's happening in these buildings at night? They're sitting idle. So the goal is to bring adults in the evening and leverage those vocational programs to train adults in jobs that are in demand, such as, the construction trades or manufacturing, for example. Another program is the Workforce Competitive Trust Fund. And that's, again, there's an investment in demand-driven programs that are created by industry partnerships to help train, and place unemployed and underemployed individuals. So, that's also done usually at a regional level where, there's an understanding of what those needs are, what the jobs that are in demand, and then how to fill that pipeline. And again, we have a new pilot program, which is called Renew. This is really geared towards larger employers. The Renew stands for Replenishing Employer Investment in Education and Workforce Training. So the idea is to create a sustainable way to continue to promote these programs, right? So right now we have ARPA funding, we have a lot of funding that's coming in where we can funnel all this investment into helping these training programs. But what happens, down the road when that money has dried up, and we're still going to need to train individuals. So that's sort of what this pilot program is trying to accomplish. So what it is the organizations will provide training for individuals, the funding will provide training for individuals, and then when an employer hires them, they'll match what the training cost was by 50%. So they're basically saying, thank you for providing us with this trained quality individual. And then they supplement that, and then that gets replenished into a fund to continue this program for it to be sustainable. So that's brand new, and that's being rolled out now. And then again, as Chris mentioned before, I would kind of give an overview of the Workshare program, which is a layoff aversion program, which is done through the Department of Unemployment Assistance. And so if your company needs to reduce payroll costs, for whatever reason, the Workshare program is something that you can leverage. So it allows you to reduce the hours of work for employees in either an entire company or a small unit or a department. And what happens is the employees will receive unemployment benefits that will supplement those reduced wages. So, why is this important? Why avoid layoffs? This way you can keep the people who you've trained continue to work. You don't have to worry about like the cost that it's going to be associated with trying to recruit and train new folks. And it also helps maintain, morale and productivity. So Workshare is open to any Massachusetts company, small or large, nonprofit organizations, government agencies. Basically, in order to kind of take part in this program, you need to have the same level of reduced hours for those groups. Between 10 and 60% is what you can leverage. And then whatever that decrease in those normal weekly hours has to be shared equally by all the employees within that group. So you can have more than one Workshare program for your organization. Like say your HR department, really needs to be reduced by 40%, but your accounting department only needs to be reduced by 10%. You can have two separate Workshare programs at the same time, but everyone in the accounting department needs to be reduced by that 10%. And everyone in the HR department needs to be reduced by 40%. So you can't, kind of say, well, this person's going to get 40% cut and this person's only going to get 10. So it's just across whatever division you have that program, everything needs to be the same. Also, this isn't allowable for anyone who's a contractor. These are for only full-time and part-time employees. And you also need to provide your benefits that you normally provide to them while they're receiving Workshare, which is great for those individuals as well. It's a relatively easy process. You just need to apply online, and you do that through your unemployment insurance online employer account. And there's a terrific video, and I can post some of this information in the chat, that really helps walk you through the process. But some things that you need to keep in mind before you get that application rolling is, who do you want to be in this program? Which departments are involved? Understanding really what your reason for having to reduce their hours is, and as well as the number of weeks that you want to use the program, including start and end dates. So what's nice about this is it extends to 52 weeks. So you can do an entire 52 weeks, whereas unemployment insurance would only cover I believe, oh my gosh, I think it's like
26 weeks.
26 weeks. Yeah. So there's a definite benefit for folks, because otherwise, if they were on unemployment, that would have run out. So Workshare will extend that time. And you just have to have the names, their current work schedules, as well as their social security numbers. So it's not a lot of information. It's
a great program, Sue, and so many companies have taken advantage of it. And thank you for including that in your update. I know you're available beyond this call. I know oftentimes you follow up with folks. So if people have questions, please follow up directly with Sue. And I thank you for being here and giving us that update. As you saw, I want to thank Catherine and Emma. They're posting all of the links to all of the information you were talking about. So that's all available now to folks.
Terrific. Thank you so much.
Thank you. So we're delighted to have Oreste Varela with us today. He is filling in for Eli Spayu, who is normally with us, and is going to give a brief just overview of some of the SBA resources that have been already instituted and enacted in the region, but also maybe a little bit of a mention on the great rates that still exist with some of the 504 and 7A loans that are out there. So Oreste, welcome.
All right, thanks, Chris, and great presentations by the two Sues. Really very interesting. This is a great, I'm out here in Western Mass. That's typically normally my territory. And I don't know of any chambers doing anything like this. This is really fantastic. So I need to tell them they need to get on the ball and do what you're doing. This is really good, really good. So anyway, I'm going to share my screen and show some slides and go through that. All righty here, let's see. All right, Oreste Varela here with the Small Business Administration. And since you know Eli really well, I don't have to go through the whole thing, but the only thing that's, I guess, relevant in this context is that in our Massachusetts office, there's only 12 of us. We have two offices, one in Boston and one in Springfield. And I'm the Springfield branch manager, but the only thing I manage is myself. So there's that. And typically I cover the 4 counties of Western Mass, but ever since COVID and we're working remotely, if there's anything good about it is that we're reaching many more people across the Commonwealth. So, and basically what I kind of want to cover in a few slides here is, let me just see here. So, sorry, hit the wrong button there. So anyway, so the thing is really 2021 was a historic year, and here in Massachusetts, throughout the country, but when we're talking about COVID recovery and the relief that was provided. And, one thing you have to keep in mind, and I'm sure you're all aware, is that all of the funds were approved by Congress. So it's not that SBA had all this money laying around, we didn't. But so all the funds, all the programs were approved by Congress. And if there's any, the question might be, what's in the future? Well, you'll have to talk to your congressman or woman and so on and so forth, kind of a thing. So anyway, just a little capture here. So the one thing's, the most important thing about SBA and its relationship with our network is that our resource partners are critical, absolutely critical to what we do. I already mentioned there's only 12 employees, SBA employees here in Massachusetts. So we desperately need our resource partners, and they delivered. Look at those numbers there, 22,000 small businesses with the SBDC centers, the SCORE chapters, the women business centers, and VBOC. Pretty amazing how many businesses were assisted or received assistance from our resource partners. And then you can see the thing is, even though, yes, there was all of the press was about COVID recovery funds, our traditional loans, which are 7A, 504, and micro loans. Close to $1 billion went out to businesses through, you can see there are 150 different lenders. In particular, the 504 loan, the rate has been so attractive. For most of 2021, the 25-year rate was hovering right around 3% or even a little less. And even now, it's just a touch over 3%. So the 504 loans, and this isn't, I'm not talking about every different loan product, but if you're buying a business that includes real estate, that's absolutely the way to go. So, and then you can see with the PPP, 21 billion. Crazy money, 6 billion for the economic injury disaster loan, 1 billion to the restaurant revitalization fund, and 360 million to the SVOG, the shuttered venues. It's just like it, when you look at these numbers, it's crazy, crazy numbers. And we're just talking Massachusetts here, so, and then forgiveness, like the nationwide, the percentage of loans that have been forgiven is 82%. So that's really wonderful. I know there's still some challenges out there and we're working through them, but it's mostly good news there. And then on the contracting side, government contracting is a huge boost to a business. It helps them to grow. And so the 8A is the 8A, if you weren't aware, it's a certification program that a business has to apply for. They have to prove that they're economically and or socially disadvantaged in some way. Typically, these are minority-owned businesses, and we have 5 new firms. And you're like, 5? What? That's not a. It's a big deal. 5s are a good number. And the hub zone, 9 new hub zones are historically underutilized business zones. Those typically are areas that are economically depressed. And so this is another type of a certification. And again, these are opportunities for these businesses to compete for government contracting, and certifications provide an advantage to this competition. And then there on the bottom there, there's the this accelerator prize competition. We have this new program, this community Navigator program, and I believe someone's going to be talking about that in a little bit here. The organization that was selected. So in terms of need, businesses that needed resources. I don't know if you can see the boxes that are annoying me here at the bottom, but anyway, I'm moving them around so I can read the slide. But 9 in 10 firms sought out some type of emergency funding to help meet financing challenge, and 82% sought out a PPP. So that's pretty high number, and I mean it's pretty straightforward. COVID took no prisoners. It affected all businesses, whether they were able to survive without assistance, but the majority of businesses needed some type of assistance. And you all know Congress passed several laws, including the American Rescue Act, CARES Act, in order to provide assistance to small businesses. And these are some of the nationwide numbers. These are crazy numbers. I'm not even sure I know how to read these numbers. They're so large. Like the approved EIDL loans. Look, 3.8 million loans, dollars, 328 billion, I think that's billion dollars, crazy money. The targeted advance fund, the targeted advance and the supplemental targeted advance, that was free money. Those are effectively grants. So over 500,000 across the country, 4.9 billion. And then the supplemental there, you could see almost again 500,000, and then 2.2 billion. And then you can see in Massachusetts, you can see what Massachusetts received. EIDL, 65,000 EIDL loans, almost $6 billion just in the EIDL loan to Massachusetts businesses. And businesses also include independent contractors. So it's not, some people think of a traditional business, oh, it's a little coffee shop down, but it could also be an independent contractor. So that's why when you see these crazy numbers, you go 65,000. There's not 65,000 businesses in Massachusetts, and I'm not exactly sure what that number is, but in any case, it includes some other things too. And then again, with the targeted idle advance over 10,000 at 92 million, and the subtotal almost 9,000 at $43 million. So it's really significant numbers here in Massachusetts. And these are just the regional numbers. Region 1 is our region, includes all of the states here in New England. And you can see the numbers there, 12 billion. And then, when you think about that, Massachusetts really got the lion's share of these because it's just a great place to do business, and there's so many businesses here in Massachusetts. Anyway, so these are just the numbers there for the region, and then onto the forgiveness. And let's see here. So you can see here the total volume, 11 million PPP loans. Let's see here. I'm just, okay, right. So the first number there is the number of loans, and then the second number is the total amount. So $790 billion. Whoa, it's making my head hurt.
Sure. Been forgiven, right?
That are forgiven. Yes.
Yeah.
So forgiveness, right? The loan count and the dollar amount. So these are what's forgiven. So anyway, you can see the totals there on the bottom. So anyway, pretty amazing kind of numbers there. And that was it for like in terms of covering the type of assistance. And so just a couple of things on this slide. If you haven't done so already and you want to stay in touch with SBA, the Massachusetts office, go to sba.gov/updates, and you put in your zip code and you put in your email, and then you will get our monthly newsletter, and then there's other information there. And so what I wanted to just talk about here, actually, I can, this is my information, and I'll pass these slides. I'll send them over to Chris and his team, so you can send them out if you choose to. Let me see, how do I stop? Oh, nope. Hold on, let me.
Well, fantastic work on behalf of you and your team there of 12, I think you said. In that volume is just extraordinary. So I want to, give you credit and kudos for the work that you've done. It does seem as though there's, like any initiative, you're going to have some residuals. I noticed there's a couple of questions that we have a person who's got 6 or 8 restaurants, and she said she applied and hadn't heard back on one of the initiatives. I wonder if somebody from your office might be able to follow up, or she could follow up with you.
So a couple of things I wanted to mention. So a lot of people were before December 31st, they were running around and calling and very nervous and upset or whatever. And the idle loan, new applications, this is what's critical to listen to. New applications ended on the 31st. So if you didn't have an application in, you can no longer put in an application for the economic injury disaster loan. But any application that made it in, and any businesses that are seeking reconsideration, that continues until the funds run out. So there still are funds available for that. So that's important. I will, even though I'll put my email in a little chat box. Let me see if hold on a second. So anyone who is having some difficulty following up, whatever, shoot me an email with your application number, and I could look up and see what's happening there. But
good. Thank you very much.
And then, yes, the other thing that's really critically important, and I see that in the chat box here, Okay, Margaret LaForest
Yep.
is on board here. And again, we started talking about our resource partners. So in whatever is happening with your business, you want to reach out to our resource partners. They're a free resource. They're going to help you whether it's structuring your business or any business challenges you have. If you're pursuing a loan, you absolutely want to work with our resource partners. They're going to review your business plan, finances, and they're going to assist you in every which way.
I agree entirely. I mean, there are so many great partners that are on the call, and also that I can see are on the call as attendees, and they've been guests over the years. So again, Oreste, thank you for your participation today. And we want to kind of continue on with the program. There are a couple of questions there and some follow-up. If you want to talk with Oreste, his contact information is right there. You just posted it. So thank you very, very much. I did want to just give a shout out to Moises Rodriguez, the former mayor, who's also the executive director of the Cape Verdean Association. We're not going to have time to hear from him extensively about the Navigator program, but it's directly related to the SBA initiative that's part of the Recovery Act. And there he is, former mayor Moises Rodriguez. How are you?
Not bad. How are things?
Good, good. It's been exciting and interesting working with you as one of your spokes. I know the Cape Verdean Association deserves congratulations for being one of only 51 grantees nationwide. And I'm excited to hear more from you when we have you on as a guest
Definitely.
to get into the details. I know as partners, we're all coming together in the next week or so to try to get all of our pieces of the grant settled, and we look forward to having you back. But I wanted people to see you and see your participation. And I don't know if there's anything you wanted to just add, just briefly.
No, I'm actually kind of happy that, for the first time in our city in a long time, we have some good news to say that, that the federal government is actually reaching into some community-based organizations to become a bridge between the small businesses and the federal government. The folks who are otherwise uninvolved, in a sense, they're not involved in some ways, and you and I have discussed that, and hopefully this program will bring people a lot closer together so we can continue to build this city and this region in an area that it deserves. So I'm looking forward to it.
Thank you. Thank you very much. And thanks for your leadership, not only as former mayor, but also the current city councilor at large. So thank you very much.
Thank you. Thank you for having me.
So we're going to move right to Dr. Alessandra Palazzi, who we're happy to have as a new member of the chamber. And, we talk a lot about health of your business and health of your physical employees and yourself. What we overlook a lot is our mental health. And Alessandra Palazzi is a consultant who helps companies get back to work. And we're going to just conduct a quick interview here. But before we do, I wanted to give you a sense of Dr. Al, as she's known, is the CEO of Verdant Consulting, which offers programs on building resiliency skills, preventing burnout, emotional agility, and psychological health and safety. She has 30 years of experience in human development, working for big and small brands, from 7-Eleven to Pizza Hut to Boston Beer Company. And following a stint of recovery from her own burnout, I think, and doing all of that, she has renewed her commitment to consulting and helping other companies identify how they can get their employees back to work amidst the recovery from here. So welcome, Dr. Al.
Thanks, Chris. Thanks for having me.
Thank you. So I've got a couple of questions here for you. Can you share a little bit about your background? I mean, we talked a little bit about it, but what services do you provide as a consultant?
Well, thanks for that. So yeah, my background is in HR and organizational leadership development. You mentioned some of the brands I've worked with in the past. And I, through my own experience this last year, while I was the chief people officer for a relatively large company, I personally experienced burnout. And so when I went to go and get a solution for that, what I found was not a lot of help. Things weren't science-based, they were opinion-based, they were spiritual-based, which is fine. But in a work environment, I couldn't find a solution that gave me the tactics that I needed. And so I decided to leave my position and build a program based on science that these could implement and meet our historical need that we have right now. I mean, when Sue was showing those numbers, it's just, I don't know about the rest of the participants, but it's just, you feel gutted because we thought this was behind us. And how do we help our teams navigate that? You know, we're all very, very tired, and for good reason, because of the volume of changes we've experienced. And so what I wanted to do was to create a program that would help people build the skills they need and the tactics so that they'd know how to respond in this kind of generation defining moment that we find ourselves in.
I feel validated just hearing you speak. I'm feeling burnout too, like a lot of people. So to tell us a little bit, we have been hearing a lot about professionals burning out, a lot in the media. What are some ways people can address this for their businesses and themselves?
Well, like I said, looking in the past, if we look to 2019 or anything before, it might as well be 100 years ago. I mean, that's kind of the before times. What we need to do is meet people in this moment. And that is pulling up, which is hard to do when you're in the thick of it, and saying, where is this headed and what is it going to look like in 2 years? If we hold our breath and think we're just going to go back to how we were, we're going to spin our wheels and burn ourselves out even more. So taking the time to give the team the skills that they need to lead and meet the current moment is some of the best ways that you can help people navigate and avoid burnout. The thing is with burnout is that it is not necessarily, it's not a personality flaw if you experience burnout. There are scientifically proven ways in which we increase and accelerate burnout risk. Things like lack of organizational clarity, confusion, poor communication. These are things that we can change that have nothing to do with, mental health or mental illness. And so there's ways that we can bolster our organizations and ourselves so that we don't accelerate that burnout and can prevent it in the long run.
I feel confident already just listening to you. So 4.5 million people resigned in November. 4.5 million. And they say there's a whole other wave of people who, once they get through this and are forced to go back to work or, look seriously at the other options that they're going to make that break. How can businesses prevent these turnover costs and retain top talent?
I mean, one of the best ways is to have fantastic leaders. People don't leave companies if they have managers they know care for them, or they're very unlikely to. But the other data point is that 86% of people would leave a company for better well-being benefits. So if I'm motivated to leave and because of that, and I'm also motivated to stay, if I have a values alignment with the organization, I feel like what I'm doing is making a difference, we're on a mission that's meaningful and purposeful, then I'm less likely to leave. And part of that is building what they call psychological safety, which I know sounds like a lot of woo-woo, like let's all give everybody free hugs, which it is not. Psychological safety, there are structures you can put in place that will create the psychological safety that will enable the team to take risks and drive innovation and help your organizations thrive. And when they have that space and you have those things in place, they're very unlikely to leave.
Interesting. And are there examples of this that you give in your presentations? I know we've scheduled a presentation with you coming up in the next few weeks. Will you get into some of that during that workshop?
Yeah, absolutely. So I'll get into some of the causes of burnout. And there's, again, it's pretty consistent what some of those causes are. I can give an example now. Role clarity is one I love to talk about because it's something that's so inane and like so basic that you think, how could writing someone's job description make a difference on their mental health or on the performance of my business? And it is fundamental because without that clarity, and again, there's all these scientific studies, this isn't just my opinion, but without that clarity, people don't know what good looks like. And maybe they're working really hard at a thing that you don't care about. And so if we don't have that oral clarity, then
are you saying oral clarity?
Roll. I know what
clarity. I'm sorry.
Roll.
Okay, I thought you said rural, and then I thought okay.
That sounds weird. I don't
Okay,
know
all
what
right,
that is. That sounds
all
dental.
right. Roll clarity. I get
Roll
it.
clarity.
Sorry.
Job clarity.
Check my
Let's just
ears.
we'll call it job clarity. There we
Okay,
go.
all right, fine,
All
okay.
right. So yeah, so that helps with burnout prevention, because if I'm working really hard at this thing and this person's working hard at that thing and we're bumping up against each other, we're going to have problems, right? And so people need that clarity to know that they're supported, know what good looks like, And that helps their business and build resiliency, as well as avoid burnout in the long run.
It reminds me of that saying of staying in your lane, right? And understanding what lane that you're in. And then
How do I know my lane?
Yeah, right, exactly. That's great.
Especially if everybody keeps, every night they come and they repaint the lines.
Yeah.
Or the
they erase
lines are
them.
invisible.
Yeah,
That's
they erase
also
them.
a thing that happens.
So everyone is hopeful that in 2022, we'll see the end of COVID and Omicron and every other version of that, and businesses can move forward and return. What are the top actions you recommend businesses take to transition to a post-pandemic office and world?
Not thinking that we're going to go in the past. So if you think we're going to go back to everyone's in the office, we have happy hours every Thursday night, like it's gone. Okay. So we got to move forward. What does the future look like, and how do you want to manage your business? Let's look at, for example, restaurants. I have several clients, and I've been in the restaurant industry myself. I've been in 15 different industries, but restaurant, I have a strong affinity for because it's operators. So think about that. You're low on talent. Let's just put pandemic over here. We have the Great Resignation. You have climate change. You have social unrest. You have lots of stresses, had nothing to do with COVID. But I've got demands from a supply chain, right? My costs are going up. I can't get people in to have servers. I'm having to close down. So I need to look at my business model and say, how is this going to be sustainable for another 2 to 3 to 5 years or forever, right? So you have to get really creative. The thing is let's say you come up with some great innovation. I don't know. You're going to have robots deliver. I don't know. But how are you going to equip people to absorb that change? Because we're all exhausted. So you're going to tell me I have to do things differently. I don't have the mental capacity to absorb that. So the other thing you can do is give people the tactics to be able to manage change and to be able to be nimble in a moment for now, not the past.
Mm-hmm. Sounds like really great advice. You know, there was a study done not long ago, well, it was probably about 15 years ago now, called Workforce 2020, and it talked about the demographic crash that was going to happen of the baby boomers retiring and the baby bust after that, and
the gray tsunami.
Yeah, it was going to happen anyway. So I think a lot of people are blaming this virus and pandemic for it. It was going to happen. It just got accelerated and exacerbated. And so I think, to your point, I wonder, as employers are calling people back, should they do, sessions with their employees, kind of brainstorm as to what they think that it would be best to?
Absolutely, Chris. Yes, but deal with your own stuff first, because the worst thing you can do, and I have seen this happen multiple times, is ask people for their opinion, then get your feelings hurt when you don't like what they have to say, and then do nothing. And again, I've had it happen several times in big companies, right? So if you're going to do that, be committed, but work through your own, whatever you have that's going to equip you to take that in as it's intended and not, get defensive.
Mm-hmm, mm-hmm. Well, thank you. You've given us some things to think about, and I certainly welcome you to the chamber and to the organization. We look forward to your workshop. I don't think we've settled on a date yet, have we?
No, we haven't finalized a date, but I did create a website just for the chamber. So if you go to verdantconsulting.net/Metro South, I've put a bunch of business burnout prevention tips together, a mindfulness starter packs, a few things for my fellow chamber members.
That's excellent. We'll include that in our wrap up. It goes out to I think it's close to now 1,000 people who have tuned into these calls over the last 21 months. So we'll distribute that link to everyone, as well as information that was shared here from each of our panelists, who I want to thank, and thank you, Dr. Al. I look forward to seeing you at the next workshop. And thank you all for participating. We are scheduled to be in person for a luncheon at the Martin Institute on the beautiful campus of Stonehill College on Friday the 28th. So that's 2 weeks from today at noon. We have a great speaker who I'm going to ask his information to be posted and the registration be posted in the chat area, so that the Mass Life Sciences Center director, the new director, is going to be speaking, as well as the folks from Stonehill College and others. So we've got a great program planned. for 2 weeks from today. We hope that you will join us there. We'll also be back after that for another call in February for a COVID recovery call. And we hope to have former Mayor Moises Rodriguez back to talk a little bit more about the Navigator program that SBA has awarded the association. And Oreste, thank you for being with us. Tell Eli we said hello. We hope to have him back or you back in a couple of weeks. And again, thank you all. And I wish you a wonderful and long weekend for some of you because MLK Day is Monday, as we know. So thank you very much for participating and tuning in. And we look forward to seeing you in the weeks ahead. Be safe
Thanks,
out there.
Chris.
everybody.
Bye.
Take care. All right. Stay well.
Thank you.
Bye-bye.
Bye.